Okay, so, as many of you know, I've been doing non-surgical skin tightening procedures for more than 4 years now. I've been using a device called Thermi, which has worked well for me. But just as everything, in life, there's always technological advancements. So this is a new technology that I'm going to try today, and I've heard a lot of great things about it. Talked to a few colleagues of mine who've been using it for a couple of years. They really like it, and the patients seem to have good outcomes. So I'm going to try it. This is called J-Plasma. So this particular patient has allowed me to record her to do the procedure. So she had a lower face neck surgery done about, I think in February time period around, this is what, I guess 5 months ago or so. And she had it done, and the reason I met her is because a friend of hers is a patient of mine, and she was referred to me because she was having complications because she had it done in North Carolina. And she came down here, and she had some hematoma that I had to evacuate. I've been following her. She had some swelling and discomfort, etc. So I've been kind of just conservatively managing her hematoma. So the hematoma is resolved. She's now back to normal routine. But she still has some laxity, under the neck here, and she's got a lot of puffiness on the side of the face, which she's always had. So the goal here is to thin this out as much as possible with the J-Plasma device, and also thin the neck out where I can get some tightening of this skin right here, which is a typical problem that even patients with surgery have sometimes. Of course, I don't know how much was done with the plication of the platysma. I don't know if the platysmoplasty was done. I'm not sure about it, so I'm going to assume that it was done. I'm going to focus on tightening up this skin here along the side, reduce the bulkiness. She's a bit puffy now because I've already injected local anesthesia here. She's already awake, and I just finished her bleph. So she's doing comfortably well. So local anesthetic, I injected about 130 cc's of local anesthetic, which has Marcaine and lidocaine, which is going to give her short and long-term anesthesia, and so she should not feel anything. This is a little bit tricky because I've done many of these with the Thermi procedure as a follow-up to kind of help a little bit of skin tightening. Because many times when patients have surgery, especially with the hematoma, there's a lot of inflammation and scarring underneath it. There's going to be adherence of the skin to different parts, and so an important part that I always do is to undermine this extensively again so that I release the skin from the attachment, so there's no pockets of issues elsewhere. She has more swelling on this side and more scarring than this side. This is the side that she had the hematoma, so I injected a bunch of fluid, tried to tent it up some, and now I'm going to start undermining it. Before I do that, I'm going to show you this device. This looks like a nice comfortable handpiece, and this is the edge of it. This is where this technology, I think, works differently than the Thermi. This is also a radio frequency based device that emits radio frequency energy, which is similar to Thermi. But the difference here is that this also infuses helium and creates a plasma field that generates temperature up to 85 degrees instantaneously. It only lasts a millisecond or less, and it cools down to normal skin surface temperature. And so for skin to contract, your temperature has to be about 65 plus degrees Celsius underneath the skin, and this is going to get to 85 instantaneously. So this takes very short amount of time. Since it cools down very quickly, it doesn't really cause any injuries, hardly ever. Not heard my friends talk about it. Since I've been doing Thermi for so long, I feel fairly comfortable with all of this. And this is the way it looks. This is the machine here. So we set it with the helium flow, with the energy setting at a certain place, and we're going to do the entire upper point, the lower part of the face and the neck with this. It's a great advantage to be a fully functional cross-service plastic cosmetic surgeon, because we can cross-use a lot of different tools from other techniques to non-surgical, non-invasive techniques as well. So this is a cannula that I frequently use for harvesting fat and also sometimes injecting fat. And I'm going to now use this, in this case, used to undermine this. So I've kind of made a little, tiny incision there, and I'm going to basically push this through gently so that I'm elevating the skin and essentially dissecting it off of the surgical plane where the scarring is underneath. And so I'm going to do this, and she should not feel any pain at all. Are you feeling any discomfort?
No.
Okay.
Well, just you.
Pushing? Mm-hmm. But no sharp pain, right?
No.
It's just pressure a little bit.
Correct.
Okay, good. So it's going through fairly well so far. So I'm going to go across the whole surgical field like this. And an important aspect about, I think, this technology that's different than the Thermi is that Thermi requires a longer application of heat, and we monitor the surface temperature with an infrared camera. Here you don't need it because the technology kind of does that for you internally, so you don't need to do that. In addition, since there's a gas that's infused called helium, I may start talking funny soon with the helium, but the helium gas needs an avenue to escape. So I'm going to make sure that she has, an incision on the other side, which is necessary to do the procedure, but also allows for the gas to escape. So there's no trapping of gas underneath the skin. And so she's going to have 3 incisions, one here, and one across the other side. And I'm also going to make sure that there's no trapping of any other gas underneath. So once this is done, I'm going to start doing the other side. And once both sides are dissected, I'm going to start the actual procedure. Okay, so I finished the right side. I'm starting the left side. I expect a more of an issue here because this is the side that had the hematoma. So I'm expecting her to have a lot of scarring here and inflammation that is still resolving. She's fully healed and back to normal. By the way, hematomas with face surgery is not common, but not uncommon either. I also get them occasionally once a year, or so, and you just manage it. It's not a big deal in the sense that you can take care of it pretty quickly. It resolves fairly well, and patients go back to normal. They just have a little delay. So she had that issue. So I'm just now taking a bit more time. And I want to make sure that I elevate this evenly. One of the things we don't want is the skin stuck in one place, not stuck in another place. And when you apply the heat, it may impact the skin differently. And so I want to have an even dissection plane. And that's the same principle we use in surgery as well. So even here, I'm going to make sure that the elevation plane is as neat and as uniform and as free as possible. So that's what I'm trying to do. I'm going to take a bit extra time here on this side. So are you having any discomfort here?
No.
Okay, good. So one of the things that I want to talk about is that, not everybody is going to be a surgical candidate or needs a surgical candidate or is ready to be a surgical candidate. So, since I do a lot of facial rejuvenation kind of surgery in my practice, I want to have various things available for various types of patients with various problems and needs. So this type of technology is useful for patients who, again, are not ready for surgery, who don't want surgery, who don't need surgery because their problem is not that bad, but do want to do something to enhance the skin tightening and whatnot in different parts of the body. And so it's good for those types of patients, and so patient selection is very important, which is true in any part of medicine, any surgery. The second part is when you do surgery, you may have some minor tweaks that you have to do sometimes because the outcome is not as good in certain areas or whatever. If that's the case, these types of tools also are necessary and important to give patients options to improve outcomes even more. And I've been doing this kind of stuff for a fairly long time because I want to make sure that I can do whatever I can with available technologies to get as good an outcome as possible. So that's what I'm doing. And by the way, since this temperature of this is high, 85 degrees, one of the disadvantages I had with Thermi was that for the body tightening, it would never reach the temperature that I wanted consistently. And so with this, I'm excited to try it on different parts of the body, especially the abdomen, the back, the flank area, the inner thighs, above the knees, because I think with this higher temperature setting, I believe it's going to have much more effective outcomes. And I have 2 more of those procedures that I'm going to do today. One is above the knees and one is the whole thigh area, the inner thighs, the outer thighs, the buttock area to tighten it. So this is going to be good to do in conjunction with liposuction as well at the same time, which is what I used to do with Thermi, but I believe for the body areas, this is going to work probably more effective. This is the third entry point, so there were 2 on either side as you saw, and this is the third one to kind of unify the central part with the sides. And again, I'm using the same incision that was used here with our surgery, so there's going to be no new scarring at all. It's a tiny little incision, about 3-4 millimeters or so small. And I'm pushing hard, but she has no pain. And this seems not so gentle, but it really is because I'm in the right plane, which means that the tissue plane underneath. So it's very, very safe. I'm just trying to elevate all this scar tissue underneath from its attachments. Lift your chin up some more. And sometimes it's great to work under local anesthesia because obviously with the right patient, they're very cooperative they follow, they help you out to position their neck a certain way. But on the other side, sometimes under local anesthesia, if patients are too anxious, it also makes it a little difficult. So patient selection is always critical in anything you do. I always try to set the right expectations. Typically with these non-surgical things, I compare it to the gold standard, which is doing a surgery, facelift surgery or whatnot. These are not that, these are less than that in any case you look at it. So you have to compare it to that. So if you were to rate a face surgery as a 10 in terms of effectiveness and outcome, any of these are not going to be a 10, but the goal is to come close to a 10 without surgery. So I can't comment on this because I'm just trying this out. But when I did this or used to do this or still do with Thermi, I usually tell them I expect about 20 to 30% improvement on a low end, sometimes 40 to 50, and in some cases a little bit higher. In this case, I think the low end is going to be higher than 20 to 30%, which is the reason I'm really trying this out. And hoping that if it is there, which I have no reason to doubt it will, I'm going to be excited to use this on a lot of patients and offer this. So, as I start this procedure, this is, the machine, and it kind of goes, I'm not going to start yet. I'm just going to, make sure that I can enter it comfortably. One of the things that, I don't want to do is to tent it up like this, because with any heat device, it's common sense. You don't want to deliver such a shallow, heat to somewhere. So you always want to make sure that's nice and flat like that. And this is something that obviously I've done with other devices. So this is, again, the principles are the same. Concepts never change. Techniques are consistent when you want to get consistent outcomes. So this is something that you don't want to do. So what does this do? When the radiofrequency and helium are going through this, like for example here, it's going to deliver, a field of heat here. And that heat is essentially going to contract tissues, because if you can imagine a piece of bacon on a pan and you heat it up, it's going to shrink, right? Same thing here. This is a piece of tissue underneath. If you heat it up, but in a controlled fashion, all the fibers and tissues are going to shrink. Protein underneath here is going to denature, meaning break down. And that's going to cause contraction, and the body is going to now have to heal that area after the injury. And that healing process, also, hopefully will cause some contraction. You can now do some interesting things with this, which I'm going to probably do as I get more comfortable with this, is now you can apply regenerative techniques here, right, for healing purposes. So if you put some regenerative processes or cells or proteins and stuff like that that help the body heal better, it may even improve the outcome, which I do now with fat grafting, which I do now with other techniques. So I'm going to try to combine all of these things. So that's what this does. So I'm not doing anything additional today.
So you always start when you see the white, the first dot, especially on the face. It's moving 1 to 3 centimeters per second.
Yeah, excellent hand speed.
Do you like our terminology?
Well, you try to make it fancy. So you could see, the gas inflates, and I can see the arc of the heat underneath. And you can see I'm not tenting the handpiece. I'm just trying to be as neutral and flat as possible.
You can go a little bit.
A little faster.
A little faster.
Great. She has a very good quality of skin.
I see that, especially for her age.
What I'm doing here is that every time you go through a pass, since it's heat, some eschar or some scars, this debris sets up here, and I'm just trying to make sure that it doesn't exist so that the gas can flow properly. So that's all I'm doing here. And it's interesting, a brush is used for more than brushing teeth. It's a sterile brush.
It's perfect. It's not denting or anything.
Okay, that's one. I'm done with the J-plasma procedure. It really only took about 10 minutes or less to do the face and the neck. And I did 3 passes across without any overlap at all because I marked my sites like I normally do. And so now when I feel the skin, there's a little bit of crackling sound, crackling noise. So now I'm going to kind of try to massage that gas out through these holes and some of that injection that I put in through that hole right there. So I'm going to try to get everything directed towards the central part where the gas is going to come out. So there's going to be less swelling like that. And I wet my hands a bit so that it glides a little easier. So this is what I'm doing here. The procedure went well without any issues at all. The tissues look pretty good. I'm going to again pass all of this against towards the incision so that all of it goes and escapes from those holes that I made because I want to minimize swelling. You feel okay?
Mm-hmm.
So how was that compared to the eye surgery? Was this more painful? Did you really feel much or?
No, about the same. Wow.
What do you think, Ho?
If it was up to me, I think you should keep doing it all day.
You feel like you're at the spa?
Mm-hmm.